What led you to specialize in integrative oncology, and how has your perspective on animal healthcare evolved?
Wow, that's a full question. I started off as a conventional oncologist. I was trained as a conventional oncologist actually on the East Coast where I'm from, and then decided that I needed a change in environment because I was tired of digging my car out of the snow. So I moved to Southern California, and thank goodness I did because I think that changed my life in multiple ways. One of them is that surrounding myself with some of the clients in the Los Angeles area that were really taking healthcare for themselves as like a top priority. Not that that wasn't happening on the East Coast. Certain places on the East Coast is just not as progressive as Los Angeles was when it came to healthcare. And so a lot of the clients and the pet parents were really thinking, well, I want to do the same for my pets that I'm doing for myself. So they were coming to the oncology service asking, well, can I incorporate this vitamin or this herb or cannabis or whatever it may be? And so I had to make a decision, right? Did I feel like I was doing enough for my patients with a conventional only approach, or could I add in supplements and Chinese herbs and cannabis and other modalities? And what that required was me to go back to school and start studying it, right? To make sure that there was enough science behind it that I could really support it and start to use it in practice. So I initially went back to school and got certified in traditional Chinese herbal medicine and enjoyed it a ton, and then started studying cannabis medicine as well, and then started to actually integrate both into my practice. And then I started to integrate some, nutrition concepts, Western herbs, and everything kind of starts falling into place. And I started to see significant improvement, first in quality. Like the cases that would go through my oncology service that were just unconventional, many of them had higher side effect profiles than the ones that were on combination. And as I mentioned, not only is that quality of life as they undergo therapy, but just even in terms of their cancer. The cancer itself may create painful conditions. It may cause anxiety within their bodies. It may cause certain cancers like brain tumors or secondary brain tumors that are primary or secondary could cause seizures. And we were able to start to improve some of the clinical signs associated with the cancer, as well as some of the negative side effects that we were seeing with some of the either cancer or the conventional modalities. And then the combination, as I mentioned earlier, can also, in some cases, really improve outcome, letting them live longer and better quality lives.
Great.